You've probably heard that the FDA has approved a GLP-1 pill. Yes, a by-mouth weight loss semaglutide pill. That these GLP-1 injections have been all the rave. Ozempic and Wegovy and Mounjaro, Zepbound, all of that. But a lot of people don't like injections, right? Well, now the FDA has approved a pill, and the pill is actually Wegovy. And so it's a semaglutide pill, the first one that has been FDA approved specifically for weight loss. Yes, there has been an oral semaglutide, Rybelsus, but that one was approved for diabetes. This one is approved for weight loss. Okay, so there was a trial, Oasis 4, where they did a randomized placebo-controlled trial, and they looked at 307 adults who were living with obesity or with being overweight. And so they either had BMIs greater than or equal to 30 or BMIs greater than or equal to 27 and at least one other comorbidity. They did not have diabetes in this Oasis 4 trial. So the other comorbidities could have been high blood pressure, kidney disease. Okay, so then they were put in the trial, 307 adults. After 64 weeks, they found that for the patients who took the medication, 25 milligrams of the Wegovy pill, the ones who took it daily and they took it religiously, they lost an average of 16.6% of their body weight, which is quite comparable to the actual injection. And for those who took the placebo, like the little fake pill or the little sugar pill, they lost about 2.7% of their body weight. And with everyone in the trial, they had a reduced calorie diet. Okay, they had some counseling by dietitians, and they also had exercise. Okay, so that's important. When you're taking these GLP-1s, it's not just a magic pill where you can take the pill, sit on the couch, watch Bravo and YouTube videos, and eat ham sandwiches. No, you must exercise and you must maintain a proper diet. Okay, so yeah, so after 64 weeks, if you took it like every day the way you're supposed to, you lost 16.6% of your body weight. And then that compared to the placebo, only 2.7%. And then whether you took it exactly the way you're supposed to or not, they found that on average, in general, after 64 weeks, people lost about 13.6% body weight, the ones who took the Wegovy pill, and those who took the placebo lost close to about 2% body weight. And so you see that there is a clinically significant difference in taking the Wegovy pill. All right, yay. So here's the other thing. If you're someone who, even if your doctors have recommended that you take those GLP-1s and you maybe just didn't love taking pills or taking injections, giving yourself shots, this is something that can be a nice option for you. And it's looking like the out-of-pocket price is going to be relatively low. They're looking at starting the initial dose, which is 1.5 milligrams, of being $149 a month. You know, and of course, if your insurance covers it, it's probably going to be even less than that. And the way the dosing will go for the pill will be 1.5 milligrams and then 4 milligrams a day. Okay, and then you titrate up to 9 milligrams a day and then 25 milligrams a day. And the reason that dose is so high when compared to the injections, because you know that for the injections of the Wegovy, your dose is going to be 2.4 milligrams of injection. Well, the reason it's 25 milligrams by mouth is because medication is not absorbed as easily when it has to be swallowed and go through the gut. And so you get a higher dose when you're doing the pill, but as far as the absorption that you get compared to the injection, it ends up being very comparable as far as the results. Now, there are side effects, and the side effects of the Wegovy pill were found to be very similar to the side effects of the injection. So we're talking nausea, diarrhea, constipation in some people. Those are some of the more common side effects that you can get with the Wegovy pill. But bottom line, you get the weight loss. You get the weight loss. Now, here is something that's going to be very important. It's important that you take these medications under the supervision of a physician, someone like me, who's an obesity medicine specialist, also your primary care doctor, your endocrinologist. It's important because you're going to hear a lot about some of the other side effects that can occur. For example, now with Wegovy specifically, oh, this is awesome. It's also approved because it helps to improve cardiovascular disease. Okay, so it helps to reduce your risk of heart attacks, strokes, things of that nature. And even if you've already had cardiovascular disease, it's something that has been shown to improve your cardiovascular disease outcomes. Okay, that's very important. But some other things, you know, I'm also a board certified nephrologist. Okay, I'm a kidney doctor, and I've had patients who've come to me and they're like, "Doc, I want to start, you know, this medication, but I hear that it can send you into kidney failure or give you kidney stones." Well, here's the thing. These GLP-1s, they decrease food noise, right? They make it so that you're less hungry. You don't crave food as much, especially, you know, you don't crave a lot of fatty foods, salty foods. But the GLP-1s also make it so that you don't crave water, right? And some people, they decrease your thirst. And that's why when you have folks who are out here taking it and they're not under the supervision of a physician, they're not hungry and they're not thirsty, they get dehydrated. And guess what? Dehydration is a major cause of kidney failure. You can get pre-renal azotemia when you don't drink enough. You know what else? If you don't drink enough, if you're dehydrated, that puts you at a very high risk for kidney stones. So it's kind of information and supervision from a physician that helps you to understand, you know, that while some people are trying to avoid GLP-1s because they're like, oh no, I don't want to get kidney disease, they don't understand that we even have trials like the FLOW trial that show that taking GLP-1s and, you know, no longer living with obesity, no longer living with being obese can also, or has been correlated with a slowing down of the progression of CKD, chronic kidney disease. You see what I'm saying? So by decreasing obesity and some of the other correlated comorbidities with obesity, like diabetes, then if you reduce your obesity and then you reduce your, chance of having diabetes, that can ultimately prevent you from having kidney disease. Okay, so you want to talk to your doctor and kind of, get all these nuances and everything. So yeah, so bottom line, the FDA has approved the pill form of Wegovy, a GLP-1. It's going to be available, according to Novo Nordisk, by January 2026. So that's exciting. The dose at 25 milligrams once a day, if taken for 64 weeks, according to the trial, the average person who took it every single day the way they're supposed to, along with a reduced calorie diet and exercise, lost 16.6% of body weight. Okay. And so, I say consult with your doctor and look into it. Now, for a lot of people still, they have the GLP-1s have a lot of stigma, or they think it's a shortcut or lazy or not doing it the right way, and people say that and they think that. But let me just tell you this, as someone who is an obesity medicine doctor. Obesity is a chronic medical condition, right? We're not just talking about obesity, you just need to get willpower or just, eat less, exercise more. It's not that simple, okay? For many people, there are genetic factors involved. Of course, there are social determinants. And for people, there are many people who have really, really, really tried, okay, to lose weight and to not be living with obesity, and they just haven't been successful. And in not being successful and still having obesity, they end up with diabetes oftentimes. They end up with high blood pressure. They end up with a higher risk for cancer. They end up with a higher risk for many comorbidities, largely because of the obesity. But if they could correct the obesity, then their overall health will be better, including arthritis, child, as well, and back pain. And so, number one, we need to get the stigma off of obesity, right? It's not just, you lazy, go move your body. Genetics. And I know that some of you listening to me are some folks who are just slim and been slim all your lives, and that's just your nature. Your mama was slim, your daddy was slim. Genetically, you might just have a higher metabolism and be slim. Either way, let's just push judgment aside and let's talk about the medical issue. Living with obesity is something that can shorten your life, right? And decrease your quality of life. It's a chronic medical condition. And so just like with many chronic medical conditions, if you are prescribed a medication for it, it's not just a quick fix. Sometimes you'll have to be on those medications for life or long term. And I say that to say, I know a lot of people are like, okay, I'm going to get on a GLP-1 or Wegovy for just a short time, and then I'm going to get off of it and I'll be fine. Well, no, not necessarily. Because even in these studies, you've probably seen, for people who stopped the GLP-1s like semaglutide after they've been on them, a good majority of them gained the weight back. So just like for some of you who are on blood pressure medications, now maybe you've done your diet, your exercise, your lifestyle, lost some weight, low salt diet. Maybe you used to be on 4 pills, and now because of all of your good work, now you're on 1 pill or 2 pills. But for some of you, you might just have a genetic predisposition to high blood pressure, and you might have to take a pill long term or for life. But guess what? You're not going to just stop the pill because you don't see it as a shortcut, because if you stop the pill and the high blood pressure spikes, you might have a stroke, right? Or a heart attack, or worsen your kidney function. Well, same thing with these weight loss medications. If you're someone who has been living with obesity, you've really tried, and now you're still doing the diet, you're still doing the exercise, but this pill for the first time is helping you to get toward your goal, healthy weight. Well, please don't beat yourself up if it means you have to take the pill for life. Maybe you won't have to take the pill every day. Maybe you'll be able to take it a couple times a week, a few times a week. I don't know. We still need to look at studies, and this is very new. But my point is, understand that obesity is not a condition of laziness, willpower. Obesity is a chronic medical condition, and I want people to look at it as such. And so we take treatments, both lifestyle and medications. We take everything that we can get if it is safe, and effective. Yeah. So that's that. The other thing is kind of the stigma. A lot of people, especially kind of people who like to be in control, type A personalities, you just really feel like if you take something like a Wegovy pill, it's a shortcut, or I failed. You better leave that thought alone. I know that when like the semaglutide, tirzepatide, when those first came out, I had folks who thought that they were just for people who were, living with a huge amount of obesity, just for people who are 300 pounds, maybe 275 pounds. But what you'll find is that many people, as they get older, or women as they become perimenopausal, postmenopausal, sometimes the metabolism just slows down. There's weight gain, and even women who are very controlled and diet, exercise, and really try to do the right things. Sometimes that food noise is there. Sometimes you have arthritis and you're not exercising as intensely as you would like to. And heck, you might gain 30 pounds, 40 pounds, 50 pounds. Now, in gaining that weight, maybe you're annoyed, maybe you don't like the way you look, but you're just like, I'm doing okay, whatever. Let me just keep trying dieting and exercising. But what happens when you go to the doctor and they say, oh shoot, your blood pressure's up? Well, we know that when you lose weight, like for every 5 pounds of weight you lose, your blood pressure might go down by 10 points, 10 millimeters mercury. So that little 30, 40 pound weight gain may now have you where you might need to have a blood pressure pill. But if you lost the weight, maybe you wouldn't need the blood pressure pill. And then also your doctor might start telling you, oh shoot, your cholesterol is up, your LDL is up, your triglycerides. And you know good and well that 30 pounds ago, you didn't have a cholesterol problem. So now your doctor's talking about putting you on a high blood pressure pill and possibly a cholesterol pill. The other thing, that hemoglobin A1C, your doctor might say, ooh, your hemoglobin A1C is up. It's greater than 5.7. And so now you have pre-diabetes. And you might be like, wait a minute, and I still think I look good. I look fine as wine. But with these 30 pounds I've gained, now my blood pressure is up, my cholesterol is up, and I have prediabetes. Say what? So you're looking at 3 additional potential chronic medical conditions that all could possibly be related to your weight gain, right? So now, would it be lazy for you to get a little bit of help to help you to get rid of those 30 pounds while still dieting, while still exercising? Like, wouldn't you rather lose the 30 pounds and now have improved cholesterol numbers, blood sugar numbers, and blood pressure numbers, as opposed to sitting there and now putting yourself at risk for heart disease and stroke? You got to weigh the pros and the cons, right? You got to weigh the pros and the cons. It's not cheating. It's not taking the easy way out. What it is being smart and using all of your resources as long as it is safe and effective. And in order to help it to be safe, that's why I say that if you do consider these medications, please don't go and be bootleg and get it from the corner man or on some online person who's not certified, and don't go borrow your cousin Pookie's or your auntie Shirley's dose of the Wegovy pills. Don't do that. Okay, do the right thing and get it and use it under the supervision of your physician. All right, but we'll have more talks like this because there have been some other medications coming out as far as helping with weight loss. But I'll keep you updated on this Wegovy pill that is coming out. 25 milligrams a day would be the ultimate dose daily. And, you know, as we get more information from the studies and as people get started, we'll talk about it.